أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على رسولنا محمد وعلى آله وصحبه أجمعين. Yes, good day everyone. Welcome to the 15th International Halal and Thai Products Conference. I'm Associate Professor Mustafa Kemal and I'm in the branch of Holistic and Functional Residual Medicine. And with you today, we're going to talk about traditional and modern medicine. I'll give you brief information. First of all, I'd like to once again greet you all again with respect and love. Yes, medicine is as old as human history and old and very ancient. During the field of science, when we look at it, the purpose of medicine is to help people, ensuring a complete recovery both emotionally and physically. Because people appear to be focused on their needs. The discipline of natural medicine draws on the religious beliefs and social structures of the indigenous people by taking advantage of the natural products around you and using recently scientifically based methods by developing therapeutic and preventive approaches. Affirming evolved over thousands of years, the development of medicine is really like this. And when we look at history, historical human beings are as old as history. In this process, public health and medical practices are really important. Today's people have developed in a way that allows them to live longer and better quality lives than ever before in human history. However, despite the widespread power and promise of modern medical science, it still affects a large part of humanity. Do or do not choose to do the practices. Most people choose traditional alternative medicine. There are many reasons for this. We'll talk about them shortly. Of course, with globalization, the change in disease phenomenon is really important in this case. The idea that naturalness is free from side effects is the one that attracts people. Conventional medicine is insufficient to cure some diseases. As you know, chronic diseases have increased dramatically all over the world. We call it non-communicable diseases. That's how it proliferates, and hypertension, diabetes, cancer, cardiovascular diseases, and cause of death increase due to these diseases. Due to increased side effects of course, medications and similar reasons, many people apply traditional methods in their applications with regard to curing the diseases. In addition, the use of these methods is temporary for years. Of course, what we call traditional folk medicine is the one that is being preferred most of the time. It's being prioritized. The fields approach holistically, and the sole purpose of these treatments is not to treat the body, but also to treat the body in and itself. The understanding the soul also tries to heal. How long does this methodology last? Available, of course, modern medicine. We are all in the modern field. Modern faculty of medicine is also in places is being used where it cannot reach those who cannot afford it. I said it traditional and complementary. It comes into play, and with the technology of modern medicine, the two are becoming synthesized, reaching healing to people. It actually makes the road easier. Look at this way. So traditional concepts that we can talk about, folk medicine, and they're basically being used in the treatment of diseases by taking advantage of things that are more natural, and it emerges naturally. Information obtained through the observation and trial and error has been passed on from generation to generation through culture for centuries. It formed the basis of medical science. For years, this is what we call ethnography and botany. So if we have teachers and friends who are trying, they also know this subject very well. There are recent studies, and currently the studies are ongoing as well, and very good results are coming out of the studies, and there are also very useful results that can be obtained through the synthesis of science and modern medicine. Although, of course, if we take a look at this, why did bed treatments become popular? What was missing in modern medicine that made it popular? Lifespan extension. In parallel, the increase in chronic diseases that are impossible and difficult to name, problems caused by side effects of medications most of the time, and chemical and some innovations therein. It's inevitable. Nature is not fitter. It's free from such side effects. And of course, environmental pollution is being found in the pharmaceutical industry in countries, in industrialized societies, and the world depends on it actually. So just enough failure to take precautions, increased sensitivity to it. The need to strengthen health behavior is really important, and new technologies have high prices, unfortunately, because healthcare personnel cannot allocate enough time to patients. When you look at the world, there is a significant difference in terms of health. Lack of personnel in this sense too. I can't spare enough time for these reasons. So traditional practices, that is GİTAT practices, applications, drop no applications, more science, of course. These practices vary from country to country, that is from culture to culture. Especially using these applications, the factors depend on human cultures. So religious beliefs are also effective in this kind of approaches, and it varies according to the traditions and lifestyles. Again, of course, structural research is also really important. So we have to talk about this scientifically, and all scientific research has shown that in the past diseases were used as treatments. From modern foundation, the history of alternative practices that expresses the transformed version of traditional practices. Modern pharmacy's establishment and creation of areas of specialization in medicine. In the modern era, there are a lot of set goals and to protect patients in the medical world from uneducated people. So I said alternative treatment methods, they are complementary. It is more accurate to say in the methods become embodied and pervasive. Of course, when we look at it from the other side, there is no disease, there is patient in this expression. Of course, now with the logic that there is no patient, there is a disease, that is, it's alienated from the patient. So applied to observe, Hippocrates' definition of disease stems from the concept of body intervening in disease agents. The main thing in the fight is the patient's own nature. Appears before us, he began this healing challenge with some helpful aids that he knew were helpful. So nature, human nature, nature essentially helping him, her on the path to the healing, basically. There is a mode, first, do no harm. In this regard, before doing any harm, this person available, helping the patient get better and get better. We are doctors here. Those who work in the field are not only those who distribute healing, but also it is also a tool that informs people about person's health conditions. We understand its structure, that is, preventive medicine is essentially at the forefront. There is already this in the world. Indeed, the world is focusing on this in a very widespread way right now. In this sense, we also focus on preventive medicine. At the point of preventive medicine, efforts need to be increased. Our country, when we look traditional and complementary medicine practices by issuing regulations, earn a very nice standard, because these applications, traditional apps, out of the applications, sometimes the patient practices that threaten your health, to escape from and suffer from it. To protect clients, this regulation is very important. It has been active since 2014, that is for the last 10 years. Really, especially physicians, dentists, for pharmacists, my area too. Many I have attended, these applications have become a certification program, and now they are actually being taught. So, and certification programs are being organized. So what are among these? If I were to list them here, is the less certified, the certified trainings on this subject in Turkey is really popular. When the pandemic intervened, it become less actually effective physically, but of course the online education has also continued. And phytotherapy ozone applications with a high probability of opening homeopaths and cupping application, and cupping, it's like the methodology that is being applied for many centuries and carries application that has been really profound in this application methodologies and used in many places, especially in Anatolia. Our people have applied it themselves. And mesotherapy, especially application regarding bees with both bees and products, and protherapy, osteopaths, and also like reflexology, and also in the field right now certified trainings are being given, and there is a standard for each and every single one of them, and it would take hours to explain the history of medicine here in such a short time. So let's just move on a bit. And of course, we can separate the modern medicine with traditional medicine. Maybe these are the ones you saw when they were separated in modern medicine. Among these, antibiotics are really important and discovered of X-rays and painkillers treatments and use in X-ray and tumor treatment, blood transfusion, dialysis, robotic surgery, and there is a lot of progression in these fields. It can be counted among the amazing and mind-blowing developments, basically. Most of us are now only concerned with the people on Earth and the people who will be sent to the space. Even if it does not happen, the people who got to space will also be the ones who got to space. A separate check health education to meet physiological meaning needs. It also organizes this. When we look at it, thanks to the scientific and technological developments, the risk of diseases has increased. Average life expectancy has increased. Reasons for increase, relatively speaking, for the sake of what we call chronic diseases that re-emerged. So this is the issue the world is struggling with the most right now. Of course, it is our wish all these positive developments in modern medicine, first in traditional medicines understanding, and in modern medicines understanding, its elements are being applied hopefully, and using it for the benefit of humanity is the one that is really of essential importance. The ability to use arguments, of course, on the road, he says that the medicine would not be an alternative. Normally it is already an alternative. There is no such approach. It is a substitute for something alternative. When modern tip replaces one of them, his sana actually becomes something different. Then what do we call this once we complete it? With traditional approaches, so it gets more beautiful, but synthesizes and has different approaches. So this is essentially the diversity of the matter. There are regions from transition. In addition of this, there are complementary methods. Some of these can be traditional and some can be innovative. I just mentioned it. The treatment from there is a new treatment. Isn't copying a traditional treatment that has been practiced for thousands of years. Isn't it traditional for thousands of years? Mesotherapy is one of the more recently used methods, and it's quite popular as well. And to be modern, commercially major support prevents side effects. It helps us treat diseases more quickly and provide a better quality of treatment. There are people who think that modern therapy is an alternative, but actually it's not like that. There are people, for example, organizations that are truly in safe hands with quality and standardization, alternative nutrition, pregnancy in institutions, complementary, alternative treatment methods, scientific, and the framework of that is also available. Experts on this subject are present around the world in transitional institutions. There are studies on this, Getafe, and our centers are related to this. There are application centers and training centers supporting people on their path to healing. The most important point here, where is this complementary treatment, and of course, modern treatment center. You have them under your control. When we look at Islamic medicine, the concept of medical prophethood is also, in fact, this is a morality that is medical ethics. Our culture is based on type of it, because Allah Almighty is wanting basically the best for the human beings. It has given human rights to the power of self-healing. This is what we call the famous system of this period, the immune system. Together with the immune system, we came across this during this period that was a great importance. Diseases are part of the process before they become chronic, caused by the person himself. It is very important for one to reflect on the path of healing without diminishing it. Our Prophet ﷺ, in Medical Nabawi, and there have been many suggestions and recommendations on this subject. We know, especially in the food and drinks, of course, whether in daily life, in our daily behavior, there are approaches that contribute greatly to our path to healing in every aspect of our lives. There are many works and many books related to the genre. This can also be read apart from that when we look at Ibn Sina, great genius. Genius also helps you in many areas. The works of Ibn Sina, it's quite popular. Approximately works in Europe, and it's been a bit like forgotten, we can say. It's very important, although knowing the natural value of these works. In the early period, we translated it into our own language. It was a helpful topic, but unfortunately, Ibn Sina's, it was translated to our language, but it's not being, given the basically the interest that it deserves. Basically, what we can say. And first countries in Europe translated this to themselves, and they were taught in medical schools in Europe. The students they read this, and so basically these approaches. Well, here is the law book. What can I say? It's a heirloom, of course. It belongs to the sheriff. And many such good quality in the works of Istanbul medical world. By exclusion, after that, we should not move. By adapting this work basically to our day, yes, to present day, modern, basically by making a synthesis with their approaches, we need to present people and distance in the new generation students. Let me see, look at this in Europe, especially this modern medicine together. It should be evaluated. And we explained that it should be revealed with methods based on scientific evidence. And we explained that in his studies, it was done intensively. Yes, especially intensively, but to what extent it is being actually used, that is a matter of question. Unfortunately, in today's world, especially when we're looking at the medicine subjects, the application of this genius approaches are not really relevant to modern day medicine subjects that are being taught in the university. Unfortunately, this is the situation, and basically, as Muslims, we gotta make sure that our genius Ibn Sina's basically approaches are being taught in the medicine subjects, and of course, it has a great impact. It should not be forgotten that it has a great impact on students, and it could foster basically their approach in the traditional and modern medicine, and in the basically synthesizing basically of those two is really of essential and critical importance, what we can say about that. And once again, it should be evaluated. We explained that it should be revealed with methods based on scientific evidence, and we explained that in his studies it was done intensively, in Ibn Sina's studies especially. We provide this piece of information when we look at it in general terms. The distinction between traditional medicine and modern land registry is also definite. Scientific matter within the causal relationship, while it requires, according to the studies, traditional medicine is based on beliefs and experience rather than logical scientific connections. But to what extent this is correct, I do not personally think that this is kind of correct, because most of the time it's the spiritual part is also really important in this case. A program of practices based on experience. Well, while researching traditional medicine, I also read a lot about the history of medicine. It was already a subject I have been studying for years. Taken from the Aztecs. at work, as well as Chinese medicine in Egypt, for example, and etc. Many different applications and point on faith and religious basically kind of approaches to medicine, and there are now 2 medical applications in Chinese TUBAP. There are students studying in traditional Chinese medicine and normal modern medicine in faculties, in fact. And you see there we're talking about life energy. The balance of the world is mentioned like this. People, the paths to healing, these are basically useful, and traditional medicine over the years now, World Health Organization to achieve the goal of health all by 2020. For 2000. Aim to actively support traditional medicine all over the world. It was the plan. So now it seems that the last 200 years, the past as modern. In the last 200 years, the past is modern. What we say, when it starts to get difficult at certain points. In traditional medicine was supported by activating the World Health Organization announced what we need to know. Traditional medicine systems in the Western bar have progressed separate paths in mutual antipathy. A more realistic European set against traditional medicine to prevent harmful practices and support beneficial ones. Valuable knowledge and skill that has proven to examine what they have gained in the light of modern science. It strives to facilitate of course, how interconnected are traditional and modern medical practices. Although they seem like 2 separate medical systems, when we look at these methods, their common goal is to heal the patient. Healing people, some of the medicines of modern medicine are now so common that they can be called traditional and have been used for generations of medicines. Is it an indication that is being reproduced among the public? Especially traditional medicine is the field of knowledge application and of medicinal plants known to be resource-consuming in modern medicine. Work by experts who contribute to modern medicine by examining the substances and plants. The presence of a field in pharmacognosy is also an indication of this. Of course, as I just told you, especially in the field of phytotherapy, acupuncture, and get it in other applications, modern medicine. There are many areas where it is used in traditional medicine. What we strive for is human health, of course. Here's a brief example. The herbalist's knowledge of imaginative medicines is at an important point. So to speak, there is increasing knowledge of these herbal remedies around the world. It has a very large popular map. We all experience this, we all use it or recommend it. Among these modern methods that I will call alternative, herbal medicines and modern treatment inside each other completely show like actually we see this as a whole. Supports when we look at the human body, such a structure is not composed of protein, carbohydrate, fat, vitamins, and minerals. It is a very complex structure. Cells, tissues, organs are interconnected. To see in the middle of the continuation of this link, utilizing the imaging laboratory perspective at the same time with the approaches in the polar field. On the other hand, complementary medicine is also important in this regard, especially in terms of operation. So the active ingredient there is proven. Many herbal products and these therapeutic products using become inevitable. It's so wide. It's like a really wide and it should be particularly emphasized that in essence holistic understanding consists of 3 approaches, that is complex approaches, and get close to the human body handling incident. It will appropriate with an approach what modern medicine has brought technologically. So with this regard, I would like to finalize my speech here. I would like to thank you very much for listening to this presentation of mine, and I hope that it was really useful, and I really hope that you will use this piece of information respectively, and if you have any questions, I'd be more than happy to address them to answer them. So once again, thank you for the Dr. Senkan Bukazar for letting me know about this conference, and I'm more than happy to be able to present my topic. Assalamu alaikum wa rahmatullahi wa barakatuh.